The ceasefire deal between Israel and Hamas is still on, but it's tenuous. Meanwhile, Gaza humanitarian aid deliveries continue after a brief pause. Joining me today is Dr. Mohamed Kuziez, who spent 3 weeks in Gaza treating children earlier this year. Dr. Kuziez, thanks so much for being here.
Of course. Thanks so much for having me, Evan.
Let's be clear right off the bat. You work for a large hospital here in the area that deals with children, but this trip was actually done on vacation time. This was something you did outside of work. Let's just start right there. What drove you to go all the way to one of the most dangerous places on the world to try to help children?
Yeah, so about a year and a half back, UNICEF declared that Gaza had become the most dangerous place in the world to be a child. And so when I work in the hospital, I'll typically be taking care of 10 to 15 patients, and then I would finish my shift and leave and find out, that 20, 30, 40 children had been killed. And so even the work that I would do in the hospital seemed pointless, because at the end of the day, I don't differentiate between the blood of Palestinian children, the blood of Israeli children, or the blood of even the patients I treat here. All of them are children, and all of their lives are sacrosanct.
We have some photos of that trip. Really difficult to look at some of these, but if you could talk specifically about this one right here. This is a pretty remarkable story. And then just explain a little bit about what you saw while you were there and what you did in terms of treatment.
Yeah, so primarily I'm an inpatient hospitalist that take care of specifically patients who have had surgery who are higher risk. And so those skills are very broad, and they extend both from the ICU setting to even something like an emergency room. And so the patient you actually had on screen right now, her name is Habib al-Askari. Habib al-Askari developed an infection called enterococcus that one of the bad side effects of it is that it can get rid of the factor within your blood that prevents your blood from clotting. And so if you look in the pictures, you can actually see she has necrosis on her fingertips. And it's a progressive condition. And so it starts off in your fingertips in the smaller blood vessels, and then proceeds up into the larger blood vessels. And so I met Habiba about 2 days into my time in Gaza. And during that time, we knew that her condition was going to get worse. And the isolate that she needs, it's called the protein C isolate, needs to be refrigerated, needs to come from a biochem lab. Both things are not available in Gaza, and even trying to bring them into Gaza was logistically very difficult. And so we requested that Habiba be evacuated, but unfortunately her evacuation was delayed multiple times because of the war. She was unable to move. She was in the north, so she had to move to the south to be closer to the Kerem Shalom crossing to finally be evacuated. And so she spent about another week and a half in the north after we had requested that she be evacuated, and then another close to 2.5, 3 weeks in the south before the King of Jordan himself interceded with the Israelis to request that she be allowed out of Gaza, where ultimately she was transferred to Jordan and underwent a triple amputation. Wow. Habiba's case is characteristic of so many children who, if they had just been able to leave and get medical treatment sooner, their conditions would not have been as bad. Habiba, when I first met her, she only had necrosis in her fingertips, and she still had good perfusion in her hands. By the time she was evacuated, she ended up undergoing a double amputation of both arms above the elbow and an amputation of her leg above the knee.
That must have been really frustrating for you as a doctor.
Yeah, it is, and this is there's a lot of cases that we would deal with that, knowing what I know working here in the U.S., where every ability and capability is afforded and used to save the lives of children, knowing that there were cases that could have been saved if only we were not in the midst of this war. It's very difficult, and it brings me a lot of personal pain from that aspect. But then also knowing that there were lives that we were able to save because we were there as well helps provide some relief.
Tell me about that. How many children were you treating a day, and what sort of situations were you seeing?
Yeah, so typically within the ICU, we would have between 8 to 10 patients. Some were more chronic, and then some were kind of more post-op. And then we had about 30 patients in the inpatient ward, as we called it, but it was not actually, because there wasn't enough room. And so patients would come, be seen by the doctor, and then go back to their tent, but on a daily basis, and they would just have their IV in their hand. And so I would round on those patients, and then I would go and work at the Baptist Hospital in North Gaza, where mass casualty incidents were brought for initial triage. And so in addition to the patients I saw while I was rounding there, regularly when we would have mass casualty incidents, you'd have 30, 40, 50 people show up, and you have to move through them quickly. Over half of those people would be children, because over half the population of Gaza is under the age of 18. And so you would see a range of cases from kids who underwent something as simple as just like a laceration because some rubble fell on them, up to and including one case that stuck with me was an 8-month-old child who had about the size of a pencil tip, a piece of shrapnel that went through the side of their head, and ultimately it led to their death. And so in any situation when these mass casualties were happening, we were seeing 15 to 20 kids in various conditions.
Wow. What are your thoughts to close on the recent ceasefire agreement and the potential impact to the children there?
Yeah, during my time in Gaza, I had a chance to see what a ceasefire looks like. And so children are incredibly resilient despite all odds. And so when we were there, we started playing Duck, Duck, Goose once there are no longer drones flying overhead. Now with this ceasefire, I'm hopeful that this will finally provide relief to the people of Gaza, but we still need to see more. Within the first 5 days of the ceasefire, 170 trucks got in when there were promised 400 trucks of aid daily. We still have not seen this flood of relief that Gaza needs.
Dr. Kuziez, thank you so much for joining us today. We'll have much more with you coming up on our shows this
Thank you so much, Evan.
Appreciate your time.